Hi, everyone. This is Sean with the Western Mass team of the MassSupport Network, here with the COVID-19 update for Tuesday, September 14th, 2020. Looking at case counts worldwide, cases have gone up about another 1.9 million in the last week. But that's in the US, though. Things are not quite as high. Things are still going up here, of course, but we have only gone up about $250,000 cases in the last week or so, which is still coming down. And here in Massachusetts, we've gone up just over 2,000 new cases in the last week, which is a drop-off from past weeks. In terms of deaths worldwide, saw about 37,000 deaths in the last week. All these numbers are 2-week averages right now because we didn't do a presentation last week for Labor Day. But in the US, deaths are dropping off as well, down about another half, like another 500 or so fewer than last week, with about 5.5 thousand deaths in the last week. Massachusetts, we saw less than 100 in the last week, 77 to be precise. So things are continuing to level off here. And the US is dropping down as well, but the world is still increasing, largely driven by spread in India, which is the biggest hotspot right now in terms of raw cases. In terms of cases as a function of population, India still is barely even registering because India is such a massive country, but just the sheer numbers, they're getting 600,000 new cases a week over there. So that's really the place to watch these days. So let's look at these visually here. This is how the country is looking in terms of test cases, hospitalizations, and deaths. Everything is dropping off here, which is great. Unfortunately, tests are still coming down a little bit in places. Some of that is going to be due to all the natural disasters going on right now as well, but there's a slight uptick from that low recently. Hopefully we can keep the testing high enough to really isolate these cases. As you can see in the cases across the country, we've done a couple of sort of steps down instead of a more precipitous decline like with the hospitalizations, where we'll drop down sharply and then plateau for a little while and drop down and plateau. And hopefully we're going to drop down again, but we might be another plateau for a little while here. And deaths, you can see again, has dropped off quite a bit there since our highs in early August. Just looking around the country here, and we're going to look at this by hospitalizations. It's just a good metric to show how significant things are, because sometimes the raw case numbers can be can hide things based on population or adequate amounts of testing, but number of people in hospitals is a pretty clear metric. And you can see how the South and West have really come down from the summer surges. The South still has quite a lot of people hospitalized, and the Northeast, of course, is remaining fairly low there, but still fairly steady, unfortunately. And the Midwest came up a bit and is still kind of holding steady at that higher level. The Midwest is, I guess, what you could call the hotspot now. In terms of raw numbers, Texas, California, and Florida still remain the pandemic hotspots. But if you're looking at by population, by number of cases per 100,000 residents, it's going to be the Dakotas and Missouri. In the Midwest, a lot of that is driven by college reopenings and cases on campus. So let's move into the developments this week. Let's see what is happening. First up, AstraZeneca is resuming their COVID vaccine trial. They put it on hold briefly last week following an adverse event in one of the participants. They actually did receive a lot of criticism from the public health community for not being more transparent about the issue that was faced there. The information we did get about the participants' symptoms actually did not come from like a direct release to the public or scientists, but actually the CEO in a meeting with JP Morgan execs, I guess some maybe stockholders for the company, and then it was then subsequently leaked. So a lot of the public health community is saying that AstraZeneca needs to be more transparent about what's going on in its trials if it wants to get the confidence in the vaccine up that people need in order to start taking these. With vaccine confidence at an all-time low, people really need to have some sense of surety that the vaccine companies are doing their best and not hiding anything. Closer to home, there are a number of schools that had to push back their openings due to community spread, often driven by large high school parties in their area. This includes some areas in Massachusetts like Dedham and Sudbury. And this kind of thing is especially tricky because it really stymies contact tracing. High schoolers at a party generally don't have a lot of incentive to be honest about their activities, and that really kill contact tracing. If you say, well, you know, who are you in close contact with? High schoolers who are going to a party where they're possibly drinking probably are not going to be willing to say that they admit they were there or sell out their friends who were there. And this is kind of that problem we get into where public health butts up against issues of things like blame and shame that make it harder for people to be honest about their activities when they really need to for public health reasons. So you alluded to earlier, on the West Coast, we still have the fires going on, and Hurricane Sally is coming in on the Gulf Coast. So we should expect both of these events to have some impact on cases, both in terms of how they're going to throw off adequate testing in those areas and how people being displaced by the natural disasters are going to increase the spread as well, both from people being crowded together and people also being moved around. So those are two more things that we really don't need to have happening right now. One last gloomy thing is that Adar Poonawalla, who's the CEO of India's Serum Institute, recently said that he doesn't believe that there will be enough, the vaccine manufacturing capability of the world basically will not be enough to vaccinate the whole world until 2024, just in terms of logistics and supply chain and actually getting those vaccines produced and getting them out to the people who need them. And the Institute produces most of the vaccines for the developing world, so they probably have a good handle on this kind of thing. One of the main issues is the cold supply chain. Most vaccines have to be kept chilled, and if you're distributing vaccines in tropical areas, that's very difficult. So it's both the manufacturing capacity just to get the 15 billion doses we need to make enough vaccine for everyone on the planet to get 2 doses of it, because most of the vaccines are a 2-step vaccine, and then it's actually getting them to everybody. And so this is still breaking news. This came out just added this within the last half hour to this presentation. So we'll see how the West responds to his statements. But even if we get the vaccine in adequate amounts in the US, we will need less than 1 billion doses to get everyone in the US vaccinated. And if we're being honest, we know that everyone in the US won't get vaccinated. But that means that there's still COVID is going to be a part of the world for many years to come, likely, even if we here in the US don't have to deal with it directly. It may be a kind of thing that if you're traveling, you might have to get a COVID shot before you leave the country to, like you get an anti-malarial medication or something like that. So then we'll just check on how our vaccines are doing here. We still have 9 vaccines in large-scale efficacy tests, phase 3. New vaccine projects are still moving up in the last week or so. 2 more vaccines started phase 1 trials because there are still, we have many frontrunners right now. We may still be depending on some of those later stage ones that are using different platforms for stimulating immune responses, which may turn out to be better in the long run. But we'll see how that goes. There are still 3 vaccines in limited use in China and Russia, but of course those have not completed phase 3 trials. No vaccine is yet approved for widespread use. All right, and you can find our data here and always follow up on the news of the day through your news provider of choice. But you know what? Look at 2 news providers to get a second opinion on some of these stories. But you can also check the COVID tracking project for the data and the graphs, New York Times' COVID tracker, and mass.gov for Massachusetts-specific data. For more from MassSupport Network, you can find us on social media or on our website. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.